This is TTT Live. I'm DK Rostar. The Ministry of Health is hosting a virtual press conference to give us an update on COVID-19 and its impact on Trinidad and Tobago. We're bringing you live coverage on TTT and Chalk City 91.1 FM, on Facebook, Twitter, Instagram, and YouTube at TTT Live Online. Now over to the Minister of Communication, Donna Cox.
Hello, and welcome to today's virtual media conference to apprise you of government's efforts to combat COVID-19. With me today are the Minister of Health, the Honorable Terrence Deyalsingh, and the Minister of Social Development and Family Services, the Honorable Camille Robinson-Regis. We also have the Director of Mental Health at the Ministry of Health, Dr. Hazel Othello. The Minister of National Security, the Honorable Stuart Young, will join us later to speak on security issues. The Minister of Health, the Honorable Terrence Deyalsingh, will now give us an update on COVID-19 in Trinidad and Tobago.
Thank you very much, Minister Cox. Good morning to my colleague to my left, the Honorable Camille Robinson-Regis, to Dr. Hazel Othello, ladies and gentlemen of the media, Trinidad and Tobago. It is my unpleasant task to raise two issues with you this morning as we continue to be a part of this global pandemic of COVID-19. On Friday last, I indicated to the country that the world had reached a grim milestone of its millionth case. I think that was about 4 or 5 days ago. As we speak now, when I look at the global figures, as of 10:05 this morning, we are now at 1,450,087 cases. In other words, there has been an almost 50% increase in cases globally in just about 5 days. 5 days, an extra 500,000 cases have been added to the global pandemic caseload. We are going to reach a milestone today of 1.5 million cases. That is disturbing. The global death rate, death toll, is 83,472 as we speak. And only so far, 309,321 persons have recovered. This is another grim milestone today of 1.5 million cases. What is Trinidad and Tobago's contribution to this? To date, as of 10 a.m. this morning, we have done 919 tests, of which 107 have been proven to be positive. When we take out the anomaly of the cruise ship numbers, which is 49, it means statistics that we could depend on, we have 58 cases out of the 107 which were imported when we take out the cruise ship cohort. The number of deaths is 8, and we have 1 discharge to date. The second disturbing international trend in the evolution of this epidemiology, notice I'm saying evolution of the thing, not that the virus has mutated, totally different issue. As this COVID-19 issue evolves around the world, the second disturbing trend is this. And this is not to trivialize the issue. 2 months ago, I remember, and everybody will remember reading literature, that the chances of COVID-19 being passed to pets and animals was close to 0. As this epidemiology evolves, you now have reports coming out of the Bronx Zoo, which has been confirmed, that a tiger and other animals have contracted COVID-19 from a human, a zookeeper. That is a worrying development coming out of the science of COVID-19. It means initially we had bat to some other intermediary, which is still unknown to humans. Then we were told initially the chances of human-to-human transmission were low. We now know that is untrue. We now know we have human-to-human transmission. We were told initially that asymptomatic transmission may not be a serious concern. 3 months later, we know that human-to-human transmission is a major concern. Now we have human-to-animal transmission. When you put that in context of what we do not know about the virus, this is a worrying trend. And because of those two developments, one, the 50% increases globally from 1 million, and by lunchtime today is going to be 1.5 million, and this now worrying development of human to animal transmission, it brings into sharp focus what we do not know about the virus. The thing is evolving. And the message has to go out to stay home. That is the only way we as humans can preserve humankind on planet Earth. Because every day we are getting new and more disturbing information. This is not a time for complacency. In coming to Port of Spain this morning, I was keeping a careful track of the traffic. Monday, there was hardly any traffic on the road. Tuesday, it increased a little bit. And today, there was actually a small traffic jam by the lighthouse. If that is an indication that we are not adhering to the calls from the Honorable Prime Minister, come down to stay home, then I am worried. I am worried. Because, and I don't know if the graphic from yesterday can be brought up. If it can, it will be useful. Anybody who is outside of their homes, not on essential business, you are the pinnacle of a pyramid of infection. You will infect 2 people, then 2 will infect 6, then 6 will infect 10, and then all those 10 persons start up their own pyramid, and you get this explosion in cases. And that is what we are trying to avoid with these stay-home orders. If the increase in traffic, which I note from Monday to Wednesday, is an indication we are not heeding the warnings, we will put ourselves in a lot of trouble. And that is the graphic that we need to pay attention to. It just takes one person to start up a pyramid of infections. And then each person at the base of the pyramid starts up their own little pyramid of infections. Please, let us stay home unless you have to go out for something essential, absolutely essential. Before I pass on to the Minister of Communications, I want to announce that we have enlisted the help of FEEL, an NGO, one of the country's best known and largest NGOs, to assist us with mask distribution. So they will be the entity helping the Ministry of Health with the national effort on mask distribution. We estimate this will start over this weekend. So FEEL, they have kindly come forward and we have accepted their offer of distributing masks. However, Trinidad and Tobago, the use of masks is useful, but it is not a license to go outside for non-essential purposes. Do not use the masks to think you are now immune from contracting the virus. The basic guideline for the use of a mask is to go out, use it when you go out into the public domain to conduct business as it regards to getting food, medicine, or other essential matters. It is not an excuse to line. It is not an excuse to have a COVID party. It is not an excuse to invite 5 people home by you and have a party. I am fearful, and I said it yesterday, while the use of masks are recommended, it is not a total defense. It is a help. So please, Trinidad and Tobago, use the masks when you go out into the public domain for essential business. We have a slight change in format today, in that we have Dr. Hazel Othello giving the clinical update. But one of the reasons I have her here this morning, and we'll be using more experts as we go along, I think Mr. Prior Bihari would remember, he asked a question about mental health yesterday. So I'm hoping we take advantage of Dr. Hazel Othello's presence to interrogate the issue of mental health at the individual level who is under quarantine, the family level, the community level, and the national level. Thank you very much, Minister Cox.
Thank you very much, Minister Deyalsingh. Well, let us now hear from the Director of Mental Health, Dr. Hazel Othello, who will provide us with a clinical update.
Good morning, Trinidad and Tobago. Today, the total number of hospitalized patients is 98. At Cora, there are 26, and they are all stable. At Couva, there are 72, one of which is in the ICU, but that person is not ventilated and is currently stable. There are also 3 persons at Couva in the HDU and 68 ambulatory persons. Of those 68 persons, 17 have been identified for movement to a step-down facility with the ultimate goal of being discharged back into their communities. Today, I want to talk a little bit about mental health and COVID, largely because there have been a lot of questions being asked by members of the public, both from the press and from persons who sometimes call the mental health unit or called their healthcare providers, their mental health workers, and so on. So I want to expand a little bit on that today so that you know, first of all, what services are available, and secondly, what you can do yourself to take care of your mental health. With respect to services, the first thing I'd like to say is that when we talk about mental health services, we like to emphasize that the vast majority of mental health services should be provided in the communities where people live. And that is the paradigm that the Ministry of Health follows as far as possible and is seeking to expand as we develop our decentralization plan. At the community level, there are always people that you can turn to, people you can lean on, friends, family, pastors and priests and other religious leaders, community leaders, people you respect, people who can be trusted to provide positive influences on your life. And those are the people who we usually turn to when we're not sure that we're doing well or when we think that we need some advice or some support. That is excellent. And to the extent that that meets the need that exists at the time, that is all that is required. So the vast majority of people who may feel anxious, may feel worried, may even feel a little bit despondent at times because of what is happening, the vast majority of those people do not need any high-level mental health intervention. And I want to emphasize that. They do not need to see a psychiatrist or a psychologist. They need to interact with the people in their sphere in a positive, healthy way, and in so doing, get the support that they need. If things develop to the point where more help is needed, then we go to other levels of care from the mental health services, whether it be a social worker, a psychologist, a psychiatrist, etc. At this time, mental health services continue to be provided by the regional health authorities to the persons within their catchment area, even though they have to take specific measures to maintain adequate social distancing, or what is currently being called physical distancing. The services continue to be up and running so that if you have a mental health emergency, you can be attended to. If you are stable and all you require is a refill of your prescription, that will be provided. There are also services being provided to people who have tested positive for COVID-19 and persons who are in quarantine or receiving treatment. Those services are also being provided by professional mental health workers from the regional health authorities, and it is being done predominantly using telephone-based interventions. In other words, is what we call tele-mental health. It's something that's relatively new to the mental health landscape in Trinidad and Tobago, but it has been used all over the world in many countries for regularly with good effect. And we have done some training with our staff so that they know what they're doing and they can provide the quality of care that is needed via this mechanism. That protects the patient from having to come into a hospital or health center setting. In other words, they get to stay at home, and it also protects staff. So that is the mechanism that we're using, the tele-mental health, and all of the RHAs have participated in that training to some extent. And it's training that can be provided on an ongoing basis. Remember, the minister said that this is something that we have to look at as a long-term situation. We're going to have to be dealing with this for some time. So we have to continue to roll out training as needed so that the services can be provided as far as they are needed. Each RHA has also made arrangements for their staff. We value our staff. We understand that this is a difficult, stressful time for many staff members. We know that you work hard. We know that you are committed to what you do. We know that many of you, in fact, most of you give your very all on a day-to-day basis. And we want to reassure you that mental health services are being provided for you. I saw a brochure that the Northwest RHA Mental Health Service has developed for their staff, and there are other methods being used to let this information get out. But basically, we're using a combination of employee assistance programs that are currently in existence for RHAs, as well as services being provided by the dedicated mental health service in that RHA. So those services are being provided, and they're available to all who need it. While I'm talking about mental health services, I want to take a little aside and talk a little bit on the subject of stigma and mental health, because it's a very important subject. People sometimes have a tendency to view the need for mental health services in a negative way, and sometimes people make jokes about people who use mental health services, derogatory comments are made, and that is unkind and it's not helpful. It can have deleterious effects. For one thing, it makes the person unwilling to access services. By doing that, it can lead to worse outcomes, because if you need a service and you don't access it, your symptoms can get worse and can be more difficult to treat. And it lowers that person's self-esteem and makes them feel bad about themselves when their situation is not something that they should be blamed for in any way. Any of us can have a problem. Any of us can have difficulty coping. Any of us can develop a mental health disorder. And just as we have no difficulty seeking help for our heart and our liver and our lung and a broken hand or a broken foot, we should have no difficulty seeking help when mental health services are needed. So I wanted to add that. And while I'm on the subject of stigma, I want to talk about something else. I want to talk about community stigma towards persons who either have tested positive for COVID-19 or people who provide services to people who are having this disease. It is unkind, it is unhelpful, and it doesn't add to the situation. It takes away from the situation. These people did not ask to have this disease. They certainly do not want to have this disease. They are being cared for. They are being provided the care that they need so that as far as possible they will recover. And when they return to their communities, they should be welcomed back. Not by hugs and kisses, mind you. Maintain the social distancing, maintain the hand washing, continue to use your masks, but do not say and do things that make people feel hurt, make them feel sad, destroy their self-esteem. And in the case of mental health workers and other members of staff working with these persons, you're destroying their morale because they're going beyond the call of duty in most cases. And when we say negative things, we make it harder for them and we demoralize them. So let us be mindful about stigma towards the use of mental health services and stigma towards persons who develop this illness. When persons return to your community, they've been treated. The chief medical officer and his team would have made sure that they're at the stage where they're not likely to transmit any disease. And at that time, there is no need to be afraid of them. There's no need to be afraid of them living in their homes or being where they need to be. They are doing what they need to do to get well. Let us do what we need to do to support them, but without the hugs and without the kisses, even though we're really happy that they get home and we want to welcome them back, let us remember to continue the social distancing. So that is Stigma. Now I want to talk a little bit about the things that we can do to maintain our own mental health. And the most important one at this time is to minimize our exposure to disturbing messages. There's a lot out there on social media, on the 24-hour news cycle, that can be very, very distressing if we pay too much attention to it. It is important to get news, it is important to know what is happening, but we do not need to bombard our minds with negativity all day long. It is not helpful, and it increases the anxiety and the distress. So let us get our information from reliable sources, such as the Ministry of Health updates, such as the Ministry of Communication, and also very importantly, such as the World Health Organization website, where a lot of valuable information is available. So we get the information that we need, but we don't bombard our minds with the negative aspects of it all day long, especially the unproven and possibly untrue information that can only increase your distress. The other important thing is to maintain some kind of schedule during this period when many of us have to stay at home. Try to do the things that give you pleasure, the things that you find relaxing. Spend time on those things so that you keep your mind in a place of peace and tranquility. And if your original schedule cannot be maintained, for instance, you're accustomed going out and you can't do that the way you normally would, create a new schedule that is positive and that is helpful. Check in with your loved ones from time to time. You may not be able to go visit them, but we have telephones, and today's technology allows us video calling on several different platforms. So particularly your elderly relatives, call them, check in on them, and make sure they're doing okay, and provide them as well with the encouragement and support that they may need. For those of you who are taking care of children, it is important to talk to them in age-appropriate language. Encourage them to express what they are feeling and reassure them that it is okay to feel a little anxious or to feel a little worried at times. But when you feel that way, you can come and talk to me. We will talk about it and we will find solutions. That's how we approach this, so that children can feel comfortable and so that they can get the reassurance and the support they need. It's very important when you're reassuring them, though, to give them realistic, positive messages. Messages such as there are doctors and other professionals who can provide the treatment that you need, that people need if they get sick, and the vast majority of people who get sick will recover. That is true, it is realistic, and it is helpful. Don't say to them the things that are scary. As far as possible, keep them close to friends and relatives so that they keep feeling supported, and again, maintain their routines. For healthcare workers, continue to talk to your friends and your co-workers so that you get support from them. Take breaks, eat healthy, exercise, sleep well, do all the things that you need to do to get the help that you need when you need it, and to remain in a healthy place from your mental health point of view. And don't forget, if you need help, please do not hesitate to ask for it. And for those who are in quarantine, please remember to maintain those routines. Please remember to maintain contact with loved ones via your telephone. Thank you.
Thank you very much, Dr. Othello, for that comprehensive update. And the Minister of Social Development and Family Services, the Honorable Camille Robinson-Regis, will now update us on the distribution of food cards, the process of assessing grants, and the payment of grants to date. She will also speak a little on domestic violence.
Thank you very kindly, my colleague, Donna Cox. Ladies and gentlemen, I'm very happy to be here this morning to give you an update on the implementation of the COVID social support measures. The Ministry of Social Development and Family Services is working assiduously to ensure that our vulnerable individuals and families are taken care of during this pandemic. I would like to start off by expressing my gratitude to, and not only my gratitude, but certainly the gratitude of the government of Trinidad and Tobago, and if I may do this, the people of Trinidad and Tobago, to the executive and staff of the ministry as an essential agency for the human service that they are providing for the people of Trinidad and Tobago. I also want to take this opportunity to express my gratitude to the healthcare personnel, social workers, garbage collectors, grocery attendants, bank employees, public transport workers, and all those who have been coming out at this time. My fellow Trinbagonians, I want to address you as a citizen of our beloved country. What is happening today is like nothing we have ever seen before. My prayer is that it will never be the new normal and will dissipate soon. But whilst it's here, it is that we must all work together in the interest of our families, our community, and our country. In times like these, people of all walks of life, no matter where you are or what you are doing, we must unite for the common good of all. We cannot control what the future brings, but we can control how we react to the challenges that may lay ahead. The crises can now define our character. We must remember that we are all in this together. We have to fight it together. What is required is collective consciousness for the sake of those who are most vulnerable and those vulnerable to the virus and those who are now asked to bear the burden of the adjustment that is required in this fight to keep the virus at bay. It is not going to be an easy fight. And I must admit that these challenges will continue. But if we listen to what is being said by the health personnel and the Minister of Health and the Prime Minister of Trinidad and Tobago, we will get through this together. I want to now report on the more than 75,600 individuals and families who have benefited from social protection measures implemented by the Ministry of Social Development and Family Services. When one considers that the average household in Trinidad and Tobago is a little over 3 persons, this indicates that the ministry has already touched the lives of over 226,000 persons since the 1st of March. The total expenditure so far for measures in relation to the COVID-19 alone is already in excess of $46 million from the Ministry of Social Development and Family Services. Allow me, therefore, to take you through the various measures that the government, through the ministry, has already undertaken. Food support for children on the Ministry of Education school feeding program. Ladies and gentlemen, on Monday, March 23, 2020, the first batch of food support cards were issued to the members of Parliament for distribution to families of children who were registered for the nation's school feeding program under the remit of the Ministry of Education. In the initial phase, each MP was given 50 cards to distribute to families who were in dire need of food during the COVID epidemic and pandemic. On March 25th, another batch of 47 was issued, and effective April 2nd, 2020, members of Parliament or their representatives received an additional batch of 100 cards each. The next batch, which will amount to 3,323 cards, will be delivered to MPs on Tuesday of next week. To date, the majority of MPs have collected and distributed these cards to their constituents. And I'm asking those MPs who have not yet collected to please collect your cards, because it is important for the distribution of these cards to these people who are now under this situation that is not of their making. Ladies and gentlemen, the expenditure for the school feeding to date is in the order of $12,357,810. We also have topped up the existing cards held by food card recipients. The expenditure to date is $17,144,100. Let me remind you that the original 50 cards distributed to households in each constituency have already been topped up in the amount of $1,020. And the cards which are being distributed now are for 3 months, and they are in the sum of $1,530 each. The Ministry of Social Development and Family Services continues to work with the Ministry of Education and all other stakeholders to address issues which arise with regard to the delivery of these cards, and encourages full cooperation from our clients for the successful implementation of this measure. I turn now to the food support. There is being done an additional payment to persons receiving food support for an initial period of 3 months. And this food support is through the food card system. We have 25,101 persons who have benefited. The expenditure to date is $11,198,250. Food support is also being provided for the children, as I said before, on the school feeding program. And to date, 8,077 cards have been distributed to MPs, and the expenditure is $12,357,810. We are, through the ministry, providing income support by way of a top-up to current recipients of the public assistance for a period of 3 months. To date, 17,834 persons have benefited from this measure. The expenditure to date is $11,438,100. I must also indicate that we are providing income support by way of a top-up to current recipients of the Disability Assistance Grant, inclusive of those children who receive a grant who are disabled in some way. To date, including the 1,535 children who received this grant, 24,627 persons have benefited. TT Post collected these checks on April 7th, 2020, and delivery has commenced. The expenditure was $11,082,150. Ladies and gentlemen, you will recall that the Ministry of Social Development has put in place an income and food support for retrenched, terminated, or persons who have now received a reduced income. The Ministry of Labor and Small Enterprise Development has indicated that they are in receipt of approximately 4,000 applications and are in the process of validating them. They have commenced sending these forms to the Ministry of Social Development and Family Services for follow-up action, and payments will commence tomorrow. We recognize that despite our best intentions, this is an area that requires urgent and immediate action if we are to get it right. We are therefore indicating that forms will be on our website, but we will also have forms at police stations, and we will indicate where these police stations are located. We are appealing to persons who do not qualify to please do not crowd the system and delay the processing of benefits to those who are most in need. Persons who are in the NIB-TT system are encouraged to follow the guidelines issued by the Ministry of Finance. Those persons who are not in the NIB-TT system will be processed by the Ministry of Social Development and Family Services. These include, but are not limited to, self-employed persons and those persons who, though employed, were not registered in the NIB system. We have found that persons are having some difficulty getting their employers to indicate that they were employed. In those circumstances, therefore, we are asking those persons who cannot get their employers to verify that they were employed to give 2 recommenders who can certify your employment status. So we are simplifying the process. For those forms that have been already submitted, as I said, we will commence payment from Thursday, April the 9th, which is tomorrow. I would like to speak about emergency food support. We have a call center that is taking calls from persons who find themselves in an emergency situation where they do not have food. Each municipality has 100 food hampers for distribution to these families who are in dire need of food items during the stay at home. And these persons can call in to our special numbers, which have been advertised, to ensure that they get this support. Ladies and gentlemen, the Ministry of Social Development and Family Services is charged with caring for the most vulnerable. And in that cohort, there are the socially displaced or the street dwellers. Let me indicate now, as I've said previously, there is a special center for care and support for the homeless persons. This has been established at Town Council Street under the care for the socially displaced persons, under the Center for the Socially Displaced Persons, which is under the care of the St. Vincent de Paul Society and the Port of Spain Corporation and the Ministry of Social Development and Family Services. Let me say that this center was set up in collaboration with the Port of Spain City Corporation and the Trinidad and Tobago Defense Force, the Army Corps of Engineers. And I want to take this opportunity to thank them for coming to our service. This facility will provide beneficiaries with cots to sleep on, bathroom facilities, and facilities for meals daily. Cots will be provided by the Ministry of Social Development and Family Services, and we have divided it into female and male separately. The call center for services continue to be operational, and we are taking calls for the various social support services daily from 8 a.m. to 4 p.m. And I'd like to take this opportunity to thank TSTT for providing us with the ability to continue this call center, and also for providing us with mobile handsets for the emergency calls. I turn now to the issue of counseling and psychosocial support, which falls under the remit of the Ministry of Social Development and Family Services to some extent. Counseling and psychosocial support are available for victims of domestic violence and victims of any form of abuse which may be on the increase given the stay-at-home measures taken to flatten the curve against COVID-19. Individuals and families are encouraged to reach out and report any incidents of domestic violence, particularly during this time, in order to receive immediate assistance and support. The ministry is cognizant that gender-based violence has no boundaries regardless of educational, economic, or professional status. As the ministry continues to promote healthy and functional families as the bedrock of our society, several efforts continue to be made under the guidance of the National Family Services Division of the ministry to collaborate and partner with various stakeholders to provide crisis intervention and referrals from the Victim and Support Unit of the TTPS, the Children's Authority of Trinidad and Tobago, Lifeline, or the Rape Crisis Center. The ministry will also work with appropriate agencies and civil society organizations to make necessary arrangements to direct victims and their families to places of shelter and safety. Ladies and gentlemen, the ministry continues to honor its commitment to existing beneficiaries of the ministry. And in that regard, we continue to make payments to 168,950 persons on time and in the correct amount on a monthly basis. The estimated monthly expenditure is $436 million to existing grant recipients. Ladies and gentlemen, the Ministry of Social Development and Family Services and the Government of Trinidad and Tobago is doing its best to ensure that you who are most vulnerable are taken care of during this period, a time when we cannot assess what the next day will bring, but a time when the Government of Trinidad and Tobago is making certain that our most vulnerable, those who may be disabled, those who need public assistance, those who are on the pension, senior citizens pension, those families who are accustomed to having school feeding for their children and may be concerned about their nutritional status, persons who are on the food card, and now persons who may find themselves unemployed, underemployed, or receiving a lower salary than they are accustomed to. The Ministry of Social Development and Family Services, with the guidance of the Cabinet and the Prime Minister of Trinidad and Tobago, we are ensuring that you are taken care of, and we'll do everything within our remit to ensure that you receive the services that you deserve at this time. We know it's a trying time, we know it's a time of angst, but we are here for you, and together we will get through this circumstance together, but we must work together. I thank you very much for this opportunity to report to you, and I wish each of you a blessed day, God's blessings, and all the blessings that the period of Easter brings to the people of Trinidad and Tobago. Thank you very much.
Thank you very much, Minister. At this time, we'd like to open the floor to members of the media. Remember to identify yourself and the media house you represent before posing your question. I recognize TV6. Urvashi.
Hi, good morning, everyone.
Morning.
Just to say that we really expected, I'm sure everyone will agree, we expected to see the Minister of National Security this morning, especially to hear from him on the monies to be paid out to private security firms. I don't know if any of you could just add to that, but as we're talking about spending money, can I ask, is there any consideration to some sort of insurance for healthcare workers who may be infected, possibly and may possibly succumb to COVID-19. But my substantive question really is on mask wearing. With respect to your advice on the wearing of cloth masks, now the WHO on Monday did speak to, just as you said, a whole sense of security, Minister, that people may mask up, relax social distancing, don't wash their hands. You said it would be a help, but then if we look at the actual research, like from the British Medical Journal, it shows that it may result in greater infection. It's interesting that we would use the CDC's guideline when the CDC has been criticized for being very silent on COVID-19. We could just look at the state of the US, one. And two, they've been also criticized for downplaying this pandemic. If I go back to the WHO, they said that there's no evidence, particularly as it relates to the effectiveness of cloth masks. In that regard, do you have any guidelines on the types of material, the number of layers required, the design, the actual specifications? Because all of a sudden we're seeing everybody who has a sewing machine now making masks to sell to the Trinidad and Tobago public. Do you think that it's dangerous and potentially misleading? Thank you.
Wow.
Minister, before you answer,
Yeah.
I just want to say that the Minister of National Security will be here. I mentioned that at the beginning that he will be joining us after 11 a.m. Go ahead.
Right. So thank you for that involved question, Urvashi. The issue of wearing masks is one which we have to approach very carefully. And since yesterday I've been saying, whilst we agree with the use of wearing masks, you identify the danger that it gives people a false sense of security. My words yesterday, which I echoed today, is that you should wear masks when you are going out into the public to conduct your emergency business. So you are going to the bank, you are going to the grocery, you are going to the pharmacy. That is where we recommend the wearing of masks. It will give you some protection, but the protection has to be taken in the context of the other measures, the other hygiene measures, which are continue washing your hands at least every hour, stop touching your face, coughing into the crook of your elbow, social distancing. And you are spot on in that masks can give you a false sense of security, but it is it's a useful tool, but it is not the be-all and end-all in stopping the spread of COVID. And look at this. At 10 o'clock this morning, I said we were 1,450,000 cases. In the past 45 minutes, the world has registered 3,100 more cases. In 45 minutes, 3,000 new cases. So the message is, masks has a role to play, but it is only one bullet in your whole ammunition of measures. Please, you hit the nail right on the head. It is not a false. It will give you a false sense of security. It is just one measure to be employed.
Thank you very much, Minister. I recognize Newsday. Is Newsday on?
Good morning, everyone.
Good morning.
Good morning. Minister Deyalsingh, I have a question for you.
Sure.
If you would permit me. I would like to know, will the government consider covering the bill for disadvantaged people who would want to go to private labs for COVID-19 testing?
So the issue of COVID-19 testing, we will provide free services to anybody to get their tests done by CARFA. Anybody, regardless of disability, income, whatever. So let them feel free to have their swabs taken, and we will do it absolutely free of charge at CARFA. The ministry has no control over the private sector. The control we have is getting them certified by CARFA and doing the protocols for reporting to the Ministry of Health.
My second question, what is the status of surgeries at general hospitals?
So,
I
yeah.
would like to know what procedures are being allowed.
Sure. So, as we indicated about 2 or 3 weeks ago, all non-elective surgeries have been rescheduled. All emergency surgeries are continuing. All deliveries in our maternity hospitals are continuing. Anything that is deemed essential and important and life-threatening will be attended to. But some elective procedures are being rescheduled as per global protocols.
Thank you very much. Loop, Titi.
Hi, good morning, everyone. Nika Pasanal here from Loop. I just wanted to speak to Dr. Othello a little bit more.
Sure.
What are some of the more common health issues, mental health issues that we're noticing coming out of this stay-at-home period? I know some people are discussing anxiety, cabin fever, that sort of thing. And what kind of at-home coping mechanisms can we recommend to kind of limit the strain on the mental health, capacities within these health centers?
Okay, well, you hit the nail on the head when you mentioned anxiety, because that's the most likely thing that we would expect to see. It's still early days yet in terms of measuring or documenting what is happening, so that we don't have any evidence based on which to say this is more frequent or this is more prevalent. But I can certainly anticipate that anxiety is one of the things that we would see happening with some measure of frequency and that we would have to manage. There's also the risk for depressive disorders, because anything that increases your stress can increase the risk for that. For people who go through particularly difficult situations, there is a risk for post-traumatic stress disorder. And I can go on and on in terms of the mood disorders, which are the most likely things to happen. Separate and apart from the mood disorders, there are a number of pre-existing mental health conditions that people may have, for which if they do not remain on their medication or whatever treatment regime they're supposed to be on, their risk for a relapse can be increased, in addition to which the additional stress placed on them at this time can increase. That being said, I go back to the measures that I've mentioned before, starting with, remember I spoke about the pyramid. So at the base of the pyramid of care, we have the people within your immediate environment who may be able to provide you with the support that you may need at that point in time. And if that is enough and you're coping after having shared what you're feeling or what you're experiencing with a loved one or with a religious leader or with someone in your community, great. If you need more assistance than that, then you need to approach a health service. And the RHAs provide those services free of charge. And once you make contact with the RHA, they will ensure that you get the level of care you need. You may only need to speak to a social worker. You may need psychological intervention from a trained psychologist. You may, depending on the severity of the disorder, need medication for an anxiety disorder. That will be determined and you'll get what you need.
Okay, and we go to Guardian Media Limited.
Hi, good morning, Minister. Good morning, everyone.
Morning.
Good morning.
From Guardian Media. Minister, last night I happened to come across a video circulating on social media of a patient who claimed to be in the Cora Hospital and experiencing some forms of physical abuse and even threatening the lives of workers. Has an investigation been launched into this?
Okay, so the key word there is claimed. I will always be at a disadvantage responding to individual anonymous claims. What I could tell you, I had a talk with the CEO of North Central this morning, Mr. Davlin Thomas, to go into Cora again and do what is necessary to make life there as comfortable as possible for all people. But again, I will always be at a disadvantage responding to anonymous claims by individuals. So, but we are treating with Cora through the Office of the Chief Executive Officer.
Thank you.
Okay, I have a question online to the Minister of Social Development. How are we treating with naturalized citizens, those not born in Trinidad, who need to submit life certificate by next Wednesday to allow pension collection?
Thank you very much, Minister Cox, and thank you very much for that question, whoever may have sent it. Please be advised that we have indicated previously that we are putting life certificates for those persons on hold during this time, and other persons who are still of the view that they have to submit life certificates. You will recall that during the budget statement, the Minister of Finance indicated that we will be stopping the need for persons to submit life certificates. So for that person, you do not have to submit a life certificate on Wednesday. Thank you very much.
Thank you very much.
You're welcome.
Power 102.
Good morning, panel.
Morning.
Good morning.
Kimberly D'Souza from Power 102 and ISO Media. My question is to Dr. Otalo. Dr. Otalo, just one question. For those who may have underlying mental health issues, how do we intend to treat with them? Because I know you said that in the initial stages, they can talk to people around them just so that they can be at ease. But for those persons who have the virus and may have underlying health issues, what are the steps that your government can take to address those?
If I understand you correctly, you're asking about people who have the virus and are having mental health difficulties at this time.
Those who would have been admitted with underlying mental health issues. So maybe they had anxiety, maybe they were depressed, and now they have on top of all of that, dealing with a positive case of coronavirus.
Okay, I have been in touch with the service providers at the facilities, and I'm not aware of anybody who has an underlying or pre-existing, as we call it, mental health disorder. But persons who are having difficulty coping in various ways and needed support have been provided with that support and will continue to be provided with that support.
We move to Lasana.
Good day, Lasana Library, Y868.
Good morning.
Morning.
Good morning.
Good morning. The Minister of Social Development, could you say what happens once those cards to be distributed get to their MPs? You mentioned the salary relief forms at police stations, but generally there's just one police station per community. Have you all considered more accessible points for people to collect these forms, and how do they move on for the MPs? That's one. And if I could ask the Health Minister, last week, I know we had 919 samples tested right now, but we don't know exactly how many persons were tested, and the CMO promised to get back to me. I'm not sure if you have an answer now in terms of how many people were tested and the target of persons we hope to be tested by the 30th of April. And also with our PCR machines, we were told on March 23rd that they should be ready for testing by the end of the week. I understand there's an issue with the extractors, but could you just give me some details, since March 23rd to now, what has happened in terms of us accessing those and how satisfied you are with those?
You want to go first or me first?
Sure.
Okay, thank you, Lasana. Nice to see you doing something besides sports. Okay, so number of persons tested, I will get that information for you. That doesn't come to me, that goes to the CEO. You asked what is the target by 30th? We don't have a target. We test based on presentation. So if people present, we test. Remember, the testing protocol is that at least you must be symptomatic. So that will drive how we test. The issue of the PCR, I did indicate yesterday, because of flight interruptions, we can't get what is called the extractor kits into Trinidad and Tobago right now. We are working through several channels. I am told, don't hold me to this, I am told that within the next 10 to 14 days, we may get some extraction kits into Trinidad and Tobago. Once we do that, we'll be able to ramp up testing at North Central. So I hope that answers your questions, Lisana.
Okay, Tobago, Channel 5.
Oh, sorry.
No.
Oh, you have another? Okay, sorry.
Hasana, you asked, yes, I'm seeing you. You asked a question to the Minister of Social Development and Family Services. Let me indicate that with regard to the food cards that the MPs are giving out, the primary target for those food cards are the parents of children who are on the school feeding program. So what we have done, we have given, through the Ministry of Education, they have given us a list for each MP so that the MP can go through that list in conjunction with principals and see who are the children who are most in need, and we access those children or those families first. And then we go through the list to ensure that we cover most, if not all, of those families. So the food cards are for that purpose, for children who are on the school feeding program. Let me also say that if we do not have enough food cards for all of those families, we are in the process of working with groceries to ensure that we provide hampers of the same value or as close to that value as possible to ensure that these families are also taken care of. So there are the food cards and there are the hampers. With regard, I'm seeing your hand up, and I'm sure if there's another question, I will make every effort to answer it. With regard to the forms, let me indicate that the forms are online, and so there are multiple entry points for applications. There is the online, which is preferred, but of course we are now putting the forms at the police station so people can collect the forms. Yes, between yesterday and today, we have printed over 5,000 of the forms to ensure that we have forms available for our clients to access the forms. I know some people have been going to social welfare offices, and we have been trying to make sure that all the persons who need to access these forms do get the forms. Let me also indicate that the persons who will be paid through the NIB system, that is the Ministry of Finance's salary grant, that will be done through the NIB system, and they are also online, and they will also have forms at the police stations.
Okay, Tobago, Channel 5.
Hi, good morning. Candace Jackson from Tobago Channel 5.
Morning, Candace.
Morning.
Yes, my question is for Dr. Othello, and I was wondering if she could provide us with some practical tips for persons who are not so used to being confined to their homes. What are some practical tips for how they can cope with being home for the next few weeks until this is all over?
Okay, tip number one, develop a schedule. So try to wake up around the same time every day, go to bed around the same time every night, and have a routine of activities that you do pretty much every day. Let that schedule include things that you enjoy doing, things that you find relaxing, things that bring you pleasure, things that keep you calm. In other words, this is not the best time to be watching the scariest movies and the things that, it's great to watch movies, but if your anxiety level is up, you don't want to be watching scary movies right now. Okay, so do things that are relaxing. Spend time with your family. This is an excellent opportunity for family bonding. Be creative. I saw something on YouTube yesterday about a family where the children wanted to go out to the dinner. And since they couldn't go out, the parents decided to entertain them by having them go to dinner at Mommy and Daddy restaurant. And they did the whole, they let them dress up, they put on aprons and served them and kept it really fun for the kids. So there are lots of creative things you can do. There's a lot available now in terms of crafting and art activities and, lots of things that both adults and children can do. For those of us, I wish I were not essential, because there are lots of things I wish I could be doing right now in terms of, things at my home that I don't normally have time to do. So, there are projects you may have had pending for a while and that may have been not getting done. Now might be a good time to tackle some of those projects. kudos to somebody who I wouldn't mention by name, but my yard is cleaner than I've ever seen it before. Thanks, since that person is not an essential worker right now. So there's lots that we can do to keep us active, to keep us feeling mentally alert and intact, and to enjoy this period in spite of the challenges that we face.
Thank you very much. We can just imagine who that person is.
We won't call any names.
We won't call any names. We move to I-95.5 with Phil Turner.
Yes, good morning to everyone. I'll start with Dr. Otello since she was there last, just a couple of questions. If she can give some direct advice to persons who would have lost their jobs, how they should cope with that, as well as persons who would have actually lost loved ones and are now unable to get that comforting hug because of the social distancing guidelines. And also, what advice she has to families who would have basically put out their medical workers from home because they are afraid of contracting the virus. And then to the Minister of Health, if he can tell us who are the persons that have been contracted to supply the masks and how they were selected. And finally, for Minister Young, if he's there, given the cease order for
Could you hold your question for Minister Young?
earlier this week, I'd just like to find out for clarity what that means for the cafeterias on board the inter-island ferries. Is it that they would be exempt from that, or will persons now have to leave home packed with all their goodies and things to eat and drink to keep them until they get back home?
Just want to let you know that the question for Minister Young could be asked later. He will be making a statement in a little while.
Okay, so let me go to answer the question about who was contracted to make the masks. The Ministry of Health did not contract anyone. This is a voluntary effort being coordinated by FEEL. So FEEL will reach out, they will get the masks, and they will distribute the masks. Let me just say, we don't want to crush FEEL. FEEL will put out, when they are ready, hopefully within the next couple of days, and communicate with the public when distribution will start, how and where. So FEEL as an NGO is in a relationship with enterprises that are making masks, and FEEL will be the ones distributing the masks, and FEEL will communicate with the public, so there is no need to crush FEEL's telephone lines now. FEEL will communicate with Trinidad and Tobago when they are ready, how the distribution will take place, where the distribution will take place. Thank you very much.
Dr. Othello, I think there's a question for Dr. Othello.
Okay, I'll try to answer all three parts of this question. With respect to those who have unfortunately lost their jobs during this difficult time, in addition to the general coping mechanisms that I've already shared, please be mindful of the global picture. This is not just somebody in Trinidad doing something to you. This is an international crisis, and people are losing jobs globally, even though we wish it weren't that way. So try to focus on the fact that this is not the worst thing that could possibly ever happen to you. And in most cases, it's a temporary situation. Do positive things with your time during this interim, and try as much as possible to find a bright side to focus on. Depend on your spiritual grounding, wherever that is, so that you find peace in that and derive comfort from your relatives and loved ones at this time. With respect to bereavement, that is difficult under normal circumstances, and it's even worse now, as you said, where the normal mechanisms that we use to cope aren't available the way they usually do. And at this time, I think it's particularly important, again, your spirituality. We're all, as I understand it, body, soul, and spirit. Your spirit needs to be refreshed and renewed in the best possible way so that you stay grounded. But also you can maintain contact with loved ones, even though you can't all attend funerals and be together and have a wake and do the things we normally do. Use the technology to keep in touch with relatives, talk together, share memories together, talk about the positive experiences that that person brought into your life, talk about the good times. Try not to focus too much on the things that you cannot control at this time. And when all of this is over, we can move on to having memorial services where we can get together and remember those loved ones in the way that we would like to. It may not be a full funeral, but at least it's something positive we can do with our families and our friends to really honor that person. With respect to stigma from relatives, I spoke about stigma in general terms, but I really, I really hope people wouldn't be putting out relatives. Maybe that has happened in some places. I know that some workers have chosen to stay at hotels and guest houses and so on to avoid exposing their relatives. But if you have been put out, I'm really, really sorry to hear that. And I hope that you can find somewhere safe and comfortable where you can be during this difficult period. And again, use technology to stay in touch with loved ones.
Thank you very much. This is a question to the Minister of Social Development. Mm-hmm. There is a situation where people from different constituencies are going to the MP where their schools fall and not to the MP where they belong. Some are being turned away because they aren't constituents there. How is that to be dealt with?
Thank you very much for that question. MPs were all advised to give cards to families residing in their constituencies. In fact, the letter that the ministry sent with the cards stated that very clearly. However, MPs are working in the service of all the people of Trinidad and Tobago. So if persons come to their constituency office who do not belong to their constituency, I would hope that the MP would contact their fellow MP and indicate that this person has come and that they should check on their list to see if the person is on their list, so that we help all those who are in need at this time. I'm sure that in those circumstances, MPs can contact their fellow MPs and indicate that this person has come to their office and they're in need of help, and if they could please assist them. I'm hoping that that is what will happen. But the letter did state that MPs need to deal with persons in their own constituencies. Thank you very much.
Thank you very much. We move to Crystal Wilson.
Hi, good morning. Are you all hearing me?
Morning. Good morning. Yes, we can hear you.
Hi. Crystal Wilson, TTT Limited. Just wondering whether or not you all have received any reports. We have had a couple calls to the newsroom from members of the public regarding the fact that they have been called out, I guess private sector, called out to work, but they're not necessarily essential members of essential service members. Any reports regarding that at all?
Yes, so that is a question that I could take. We are getting reports and requests. Many of those requests cannot be granted because those services are not deemed essential. For guidance, I will refer everyone, employer and employee, to refer to the latest regulations which were posted that clearly identifies which services are considered essential, which services are considered non-essential. The guidance is there, and I think if people call to the newsrooms, you could familiarize yourself with the latest regulations put out, and we could guide people accordingly.
Okay, thank you very much. Ladies and gentlemen, we told you before that the Minister of National Security will be here. He is here. So let's hear from the Minister of National Security, the Honorable Stuart Young, to provide a security update.
Good morning. Thank you very much, Minister Cox, Cabinet colleagues, Minister Robinson Regis, Minister Deyalsingh, members of the media, wider viewing and listening public of Trinidad and Tobago. I have come here this morning really as an appendage to address a specific issue, and that of security and the security of Trinidad and Tobago at this time. But before I get to that, I'd really like to take the opportunity to thank the vast majority of our population in Trinidad and Tobago for heeding and adhering to the social responsibility measures that we've put in place, the stay at home, stay safe and stay alive. By and large, especially with the latest measures that came into place yesterday with the closure of groceries and pharmacies at specific times, we have found that the vast majority of Trinidadians are adhering. This morning as well, in my daily meeting with the Commissioner of Police, the Trinidad and Tobago Police Service, the Chief of Defence Staff, some officers of the Defence Force, as well as our intelligence services and the NOFC, we are monitoring what is going on. Population of Trinidad and Tobago. In national security, and I dare say in every ministry in Trinidad and Tobago and any successful business, you try as best as possible not to be reactive. You try as best as possible to look on and to predict as far as you can down the road and to take proactive measures when you see things that may be coming on the horizon. At national security, one of the things we do is we try to plan for the worst and hope for the best at the vast majority of times. The issue of crime and criminality, as you know, is an international and global one. The coming of this global pandemic of COVID-19 has affected the whole globe, and you see how things are happening in other areas of the world. And one of the things that we did a few weeks ago, even before we started to have the number of positive cases coming from the Ministry of Health and the information related to it, is we sat, this is along with the Trinidad and Tobago Police Service, or Trinidad and Tobago Defence Force, our Prison Service, and our intelligence services, and the National Operation Fusion Center. And we began planning and plotting for possibilities, eventualities, and certain issues that we believed could take place. You also know that we have limited resources, that is with our police service and our defense force, and I will tell the population very shortly what it is that they are occupied doing. There is this massive body out there of persons who have a certain element of platform training in assisting in security and assisting in helping the population to feel more safe and secure. So, at the urging of the Trinidad and Tobago Police Service, as well as consultation with the Trinidad and Tobago Defence Force, took a decision at national security level after certain consultation for us to begin exploring, should this COVID-19 make us increase measures in Trinidad and we then have to spread our resources further, what are the opportunities or what are the options available for us at national security to try and relieve some of the areas, not fully, but to provide assistance to our Trinidad and Tobago Police Service and our Defence Force. And when you look around the world, one of the first areas that comes up is those who are supplemental security services in Trinidad and Tobago called the private security firms. This is an area that was looked at. What was interesting is that in February 2014, the then cabinet, the then government, took a specific decision with respect to the utilization of that, at that time, of certain private security firms. So we went back because I don't believe in reinventing the wheel, but I always believe a wheel can be improved upon if it makes sense. At the time, what we foresaw was that we needed to keep the population safe, and in particular areas of the population, especially if there were going to be certain measures put in place. The first thing I'd like to say, the utilization of these 4 security firms are the same 4 security firms that were approved by Cabinet in 2014 for the same neighborhoods throughout Trinidad in a pilot project initially in the north, in the east, in central, and in south of Trinidad throughout a variety of neighborhoods and a wide-reaching expanse. This was being done with no additional powers being granted to these private security officers. They were merely being asked, they were not even armed, to patrol neighborhoods quite the way that we see in a lot of neighborhoods throughout Trinidad and Tobago now, Lange Park in Chaguanas, Palmis in South Trinidad, and other areas where you have private security officers just driving around in vehicles. If they see persons can stop them, ask them if everything is okay, but they are not intrusive. At no point in time was this concept meant to implement or to enforce any of the measures passed in the regulations to deal with the COVID-19 pandemic. It was really to provide extra eyes and ears, feedback into the Trinidad and Tobago Police Service and our National Operation Fusion Center for us then to be able to dispatch our resources if and when needed. Of course, these patrols were not going to go into areas where there is a prevalence, of criminal activity known as our hotspots in Trinidad and Tobago. But what it would have allowed is our police service and our defense force to focus on specific operations that need to be carried out, and also, especially at this time, when we are being called upon in national security and in particular our police service and our defense force to do a lot more. The population would have realized by now, because we're into about our second week of stay at home, with our third week of us implementing measures, closure of bars, closures of restaurants, closures of clubs, closures of casinos, the closure of our borders. And persons would by now recognize and realize that we are not in normal times in Trinidad and Tobago. And what is happening is you then have persons congregating. As we've been saying, the Ministry of Health has been telling us throughout, the fight against this virus is a fight against contact spread. So even when we had persons at one stage gathering outside of the banks and the supermarkets, it took a couple of days before they began understanding the social distancing and what that means for each individual on a personal level. We asked the banks and the supermarkets to put markings for persons to understand where they should stand. Who did the population at that time call upon to enforce personal social distancing? The Trinidad and Tobago Police Service. Is this something that Trinidad and Tobago Police Service is doing throughout the country on a normal basis pre-COVID-19? The answer is no. But of course, their resources were being called upon. Also, there was the discussion of people gathering and rushing to these places and a need for a presence. The Trinidad and Tobago Defense Force stepped in to provide support. At every stage in our operations, in particular over the last few weeks as we've dealt with more and more measures geared towards keeping the population safe in this COVID-19 pandemic, our Trinidad and Tobago Defense Force has been playing a purely supportive role, not only to the Trinidad and Tobago Police Service, but in particular to the Ministry of Health and the Ministry of Social Development and other areas. So I'd like to use this opportunity now to just give a very brief report as to what it is our Trinidad and Tobago Defense Force has been very busy at work. Understand the Trinidad and Tobago Defense Force, like armies, regiments, and other military organizations across the world, they are not into public relations. They do their job very effectively, efficiently, and quietly. But in my conversation this morning with the Chief of Defense Staff and his officers, I said it is time that we start telling the population and providing them with the information as to exactly what our defense force is doing. Because there's some very loose conversations taking place that there are thousands of persons on our defense force and they're doing nothing, and very derogatory statements being made about them shining their boots in camp and this type of thing, which is the furthest thing from the truth. Right now, we are assisting with the socially displaced and vulnerable in Trinidad and Tobago, and I applaud the Trinidad and Tobago Regiment. The Ministry of Social Development requested their assistance. Immediately, they moved into the Riverside Plaza, and they have been building out, and it is quite an operation, and at the end, when they complete it, the facilities at Riverside Plaza, that is being done by our defense force. When you see the completed project, the end of it, you should be very proud of what the defense force has done. They have revamped the whole inside, they've built out rooms for persons, they've improved the toilet facilities in a 24 to 48 hour period. This is one of the operations the defense force is busy. The preparation of Kuva and Kora, it took place overnight when the Ministry of Health one night a few weeks ago asked us at 9 o'clock at night to prepare to move beds from Kuva to Kora for us to be able to provide facilities for those who may be quarantined and those who may tested positive for COVID-19. So whilst the rest of the country was sleeping, or the vast majority, the Defense Force got busy, and by the following morning, Couva and Cora were up and running. They've also been very busy with the Ministry of Health, going from location to location to identify where other medical setups can be provided. They've done the indoor facility in Tacarigua is now outfitted. That was done on the direction of the Ministry of Health by the Trinidad and Tobago Defense Force. The securing of all of these facilities is being done by the Defense Force. Cora, Couva. Last night there was an operation by our Coast Guard to bring a positive patient from Tobago via a Coast Guard vessel that had to be properly sanitized, outfitted for the operation. That took place last night. At 4:30 this morning, the Coast Guard, under the supervision of the Ministry of Health, were able to bring the person to Trinidad for that person to get medical attention at either Cora or Couva. All of the movements of persons, the operation for the persons who came off the cruise ship from Guadeloupe, as soon as their flight arrived, Trinidad and Tobago Defense Force was mandated to take that operation. As soon as people came off the plane into a sanitized bus, the Defense Force were the ones who safely moved them, looked after them, got them to Balandra, secured the Balandra facilities, and continued to do so. The movement of persons from quarantine to facilities is done by the Trinidad and Tobago Defense Force. The current facilities of Balandra, Couva, Cora, and others, the preparation of the Napa facility in case we need to put persons there for quarantine or isolation purposes, Trinidad and Tobago Defense Force. The Brooklyn place in Sandy Grande, Trinidad and Tobago Defense Force. The continued assistance of joint patrols, including the IATF, is being done by the Trinidad and Tobago Defense Force in collaboration with the Trinidad and Tobago Police Service. Constantly, the Trinidad and Tobago Defense Force is being called upon to provide support, not only to our police service, who themselves need to be congratulated for really stepping up to the plate once again and doing in a very difficult time what needs to be done to make Trinidad and Tobago a safe and secure time in this pandemic that we're dealing with. One of the things you would have noticed throughout other jurisdictions around the globe is we're seeing in New York, which is now ground zero, the epicenter, unfortunately, in the United States of what is happening with the COVID-19. You're seeing first responders, not only the health workers, the fire service, and the New York Police Department starting to suffer with their numbers. We in Trinidad and Tobago are not immune. About a week ago, just over a week ago, we had a police officer at Aruca who went in for testing, and immediately him and a couple others took out 100 personnel from the Trinidad and Tobago Police Service that we had to put into isolation whilst tests were being carried out, and it led to a temporary shutdown of the Aruca police station. So in our preparation and planning for what may happen, we believe, on the urging of the Trinidad and Tobago Police Service, with the consultation with National Operation Fusion Center and the Defense Force, that we could have utilized the private security firms, not reinventing the wheel, but going back to what a previous cabinet had gone through with their procurement and the identification of neighborhoods throughout the length and breadth of Trinidad and Tobago to provide support for the Trinidad and Tobago Police Service. Right now, we also have our Defense Force guarding the military installations and a number of other places throughout Trinidad and Tobago. Maritime operations, we have 4 of our large patrol vessels out there on the seas conducting operations and continuing to do so. We are assisting in moving patients, not only via maritime, but also on land. All of the movement of patients from various health organizations to Cora, Couva, and from Balandra and other institutions that are currently under the Ministry of Health is done by the Trinidad and Tobago Defense Force. They are providing border security, both at land as well as sea, and now we are also utilizing our Air Guard, which is the air unit for all of our national security, in the type of patrols that are being done. So we have sea and land patrols on our borders taking place, aerial patrols. Our Trinidad and Tobago Defense Force continues to maintain at each of our military bases standby operators, because of course you need, in case something happens, that we can very quickly dispatch to support our Trinidad and Tobago Police Service. So for example, the other day when we had a disturbance at the prison, the outer perimeter of security was immediately provided by the Trinidad and Tobago Defense Force. You must always have these standby operators ready to launch at a moment's notice. The same applies for Trinidad and Tobago Coast Guard, who are using the interceptors that we've refurbished throughout the Gulf of Paria and in other areas, and they're doing a very good job at it. We're moving persons discreetly on the instructions of the Ministry of Health. So these are just some of the operations that I can talk about. Of course, there are many other operations taking place right now with the Trinidad and Tobago Defense Force supporting our Trinidad and Tobago Police Service. People of Trinidad and Tobago, the truth is the pandemic brings additional strain on your resources. The response, if it's going to be a proper response in protecting our population, does bring additional strains, not only in national security, but also in other areas of government. You heard the Minister of Social Development talk about the additional that is being done from the Ministry of Social Development and Family Services. You've been hearing from the Ministry of Health talk about a parallel healthcare system where normal day-to-day activities in the healthcare system continue in addition to a parallel operation to deal with COVID-19. National security is no different. What we had put in place was done properly, as it always is under my tenure, as well as the point is to provide additional support. At no point in time were these patrols going to be armed. At no point in time were these patrols given any additional power, any additional legal authority whatsoever. Those who continued to be estate constables precepted may have powers of arrest under the existing legislation as they currently do. When you go to the vast majority of private institutions in Trinidad and Tobago, your supermarkets, your pharmacies, your banks, it is the private security guards who are providing the service to us in Trinidad and Tobago and supplementing our current law enforcement personnel. This was the whole plan and purpose behind it. It was done as a proactive measure because when we analyzed what was going on and what could come, it was felt after direct conversation, consultation, and suggestions of our Trinidad and Tobago Police Service, Defense Force, and Intelligence Services that this would be a step and a move in the right direction in a pre-planning phase in case we start to have strains on our resources of the Defense Force and the Police Service. So I hope by now I've debunked this very loose conversation and the myth that our Defense Force are not doing anything. Persons are also suggesting, but shouldn't the police be the ones to do the patrols? The answer is yes, the police are doing it. You're seeing the police throughout the length and breadth of Trinidad and Tobago doing what it is they're supposed to do and more at this time of our response in a global pandemic and the COVID-19. But everyone has limited resources. It is impossible in Trinidad and Tobago or any country in the world to have police and defense force resources in every neighborhood, on every corner, and doing what needs to be done. So this move, this gesture, this measure was meant to be in the best interest of the people of Trinidad and Tobago. Having said all of that, it has become apparent in the last 24 hours, and I did not want to take up yesterday's press conference where we came to discuss the new measures that were announced by the Prime Minister on Monday and to provide clarity dealing with this particular issue. I was going to have a very separate press conference to deal with this. I was giving the patrols 2 days for them to get out there to iron out their kinks and their creases. There are 2 further points to be made. This measure was only put in place until the 5th of May, a few days, 5 days after the current end of our stay-at-home measures on the 30th of April. It was not meant to be a long-term arrangement for a very specific purpose. I will also place on the record here that we negotiated a price that was even cheaper than the initial pilot price that was implemented in 2014, some 6 years ago. And that is how we were protecting the taxpayers of Trinidad and Tobago. So these are the measures that we had put in place in order to add an additional layer of protection for Trinidad and Tobago, not for the implementation or the enforcement of our regulations, not to trample on anybody's rights. That would never have been the intention under this administration. This was meant to provide a level of safety, comfort, and the perception of crime to tackle that face-on, frontally, in neighborhoods distributed throughout Trinidad and Tobago, neighborhoods agreed to by a previous cabinet in 2014, and we were following exactly that model. Having said all that I've said, it has become apparent in the last 12 to 24 hours that there are certain voices and the population of Trinidad and Tobago and the taxpayers who we respect believe that they currently feel safe enough and there is no need to add any additional layer of security to what our defense force and our police service are doing. They're giving of human service and duty. It is clear to us that many people already feel secure and they believe there is no need for this extra proactive measure that was designed and being implemented to give extra comfort to the population of Trinidad and Tobago. We have heard from the population and are very happy to hear that the population feel secure without the need for any additional measure that was not even going to cost a fraction of what other measures are costing, and only for a period until the 5th of May. So the population have said that they feel safe and they feel secure, and at National Security, after consultation with the Prime Minister, we have taken a decision to immediately cancel this residential patrol system, and as at this time, I'm going to be approaching the 4 security companies, thanking them for stepping forward in a very short time frame, because the first meeting took place last week Friday or last week Thursday, and I asked them to be ready to commence on Monday of this week. They moved heaven and earth to be able to provide that additional layer of comfort to us in Trinidad and Tobago. But having heard from the population and those with the voices, we have taken a decision. I've taken a decision after consultation with the Prime Minister for us to cancel this residential patrol. I hope and wish that Trinidad and Tobago, that God continues to bless us, and we will continue at National Security to do everything we can with our resources to ensure the protection of Trinidad and Tobago and the population of Trinidad and Tobago. Thank you very much.
Thank you very much, Minister Young. And I would now like to recognize CNC3, Akash Samaru.
Hi, good morning, everyone. Good morning.
Morning, Akash.
Hi, morning. Minister, you kind of threw me off there with that last point. So the thing is cancelled. Now I have to ask you, we seem to have different Facebook feeds, because is it due to people feeling secure, or is it due to the backlash that this was cancelled? Because I saw more criticisms and people saying they already feel secure, because yesterday it was quite concerning how this information was put forward. We got a media release with very little detail yesterday. Questions were sent to you. You saw the questions, you didn't respond, and there was another hastily sent media release, just a few lines saying they don't have any additional powers. You didn't even tell us at that point that you were planning to clarify in another media conference, so we weren't sure where the information or details were coming from. Did you not anticipate the backlash?
Thank you very much, Mr. Samaru. I don't think sometimes it's appreciated by individuals that when you're messaging me in particular, I can only speak for myself, that I'm also getting messages from a vast and wide variety of other media personnel. So to sit and respond to each media personnel, as opposed to taking a decision to put out a blanket response, taking into consideration the message of what the media are sending you, that is a decision that was taken. Now, I just want to say that what you've recounted there, from my perspective, is not an accurate recount from my perspective. I'm not disputing what you have just said, because what I saw and what was sent to me is a leak from a police station where a specific patrol, because what was asked for by the Commissioner of Police, that each of these patrols in the pre-arranged, pre-agreed neighborhoods would go into the nearest police station, log in before, when they finish their patrol, come and log off. That allowed the police to know what was taking place, but it also allowed us to protect the taxpayers and to make sure there was an accountability. What happened was a leaking of that. A particular political operative then picked that up, ran with it on social media, and what I found very interesting is that then another political operative did the same thing. And the questions that I was getting from a variety of persons across the media completely reflected what was being put out. So at that stage, I did not have the opportunity, the ability to do what I'm doing here today, which is come to a media conference and clarify. So we set out press releases, left it at. But I don't know what it is you saw on social media. We are not guided by social media. In fact, what we are guided by is messages relayed to us by the public of Trinidad and Tobago. After consultation with the Prime Minister this morning, it was felt that is the messages coming across. Persons are raising questions with a measure that was being put in place for additional security and additional perception of feeling safe and secure. So a decision was taken. If everyone believes that the police and the defense force are doing enough and they're more than capable, we will go down that road. Because at this time, there is absolutely no need for any distraction. We remain focused in the government. National security remains very focused, and we're clear at the job that we have to do. So this is solely a reaction by persons asking the types of questions. Is this necessary at this time? We've listened. It is now cancelled.
Thank you very much, Minister Young. There was a question from I-95.5 with regards to the closure of restaurants on the Inter-Island Ferry. So we'll go to I-95.5 with Phil Turner to ask a question now to the Minister of National Security.
Question, yes.
Yes, thank you very much. I just wanted to get confirmation with the closure of the restaurants earlier this week and what sort of impact that will have on the cafeterias on the inter-island ferries, whether they are going to be exempted and allowed to continue to operate, or will passengers now have to basically pack a backpack with all their eats and drinks to keep them until they get back home. And while I have you here as well, I don't know if you're able to see, has the Coast Guard detected any sort of maritime activities in keeping with the recent developments in Venezuela? Thank you.
Sorry, I didn't pick up the last part. Has the Coast Guard detected any increased activities with respect to the development of what? I just missed the last part.
Yeah, in terms of the Coast Guard, whether they have seen any activities on the sea that may indicate something that may be taking place in Venezuela in terms of intelligence-wise.
Okay, thank you very much. Let me deal with the second part first. As you ended there intelligence-wise, so obviously we wouldn't come here on national television and provide any intelligence. But what I can tell you is no, by our radar system, our coastal radar system that expands up the OECS islands as well, there is no unusual activity detected at this time. With respect to your first question, it's a good question. The Minister of Health and myself yesterday were approached on numerous occasions by a vast and wide expanse of persons asking about the delivery of food and the catering of food, etc. Understand that what is driving that policy is a health decision where we've been told that we need to get as many people to stay at home as possible. This country will recall a time prior to all of these catering services, all of this fast food, all of the types of food that are available for purchase. Persons used to pack their lunch, carry their food with them on a daily basis. In fact, I recently have even got myself a lunch kit and do the same thing as best as I can. We are in very unusual times. We don't want to put anybody at risk. I heard Minister Deyalsingh answer a question earlier about essential services, and even in essential services, our regulations say only essential workers should be out. So at this stage, our fast ferry does the trip in under 3 hours or about 3.5 hours. And on the cargo ship, well, persons on the cargo ship are accustomed with their long drives, etc. We're asking persons, pack your backpack. I don't think you need as much food as a backpack. Pack your lunch kit. Take your food with you. It is better for you, it's safer, it's more secure from a public health perspective, because you would have done that in the sanitation of your own home and not run the risk of somebody with COVID going up to the counter in the cafeteria, putting their hands down, sneezing on the counter, etc., and then contaminating that area when your food is then passed across to you. This is being done. There is going to be inconvenience. We said that from day one. With measures designed to fight COVID-19 and the spread, there are going to be inconveniences to us all. This is one of the inconveniences. Bear with us. Let's get to April 30th. Let's stop this spread. Let's stay at home. Let's fight this COVID. And sorry, on the ferry, take your food with you, is our advice.
Thank you very much. IETV.
Hi, good morning, everyone.
Good morning.
Good morning.
Okay, so my question goes out to the National Security Minister. Two quick questions, please. Minister Young, worst case scenario, would the security firm's arrangements be reconsidered if the situation escalates security-wise in TNT? I know you said it was costing a little under or less than it would have cost in 2014. If possible, can you give us the cost, since it will be less or would have been less? And finally, final question, someone reached out to us via our Facebook page. The person said he and his wife, they traveled on November 19th to the US. Their return ticket was due on April 5th. So they're wondering in terms of the overstaying policy in the US, meaning that their ticket date has passed. Any assistance would any assistance be given to citizens as they are running low on finances? And would you consider temporarily reopening the borders for flights only into TNT, the persons to Barbados, Suriname, and the US only? Thank you.
All right, you asked a host of questions there. Let me start first of all with the cost of the security. Each patrol, we had negotiated a cost for each patrol for this period of a month at $87,000 for the month. The prior cost per patrol in 2014 for the pilot project, which then developed and mushroomed into a much bigger project that cost, I believe, a couple tens of millions of dollars a month. Those patrols in the pilot project were initially about $95,000 in 2014. We got it down to $87,000 for this month, and we were intending to go for the month. With respect to your question on the particular incident of persons who are in the USA, the borders are closed. At the end of the day, there are very few planes flying in the world when you look at what is happening. One thing that seems to be agreed by all of the countries in the world, because they've all closed their airports except for absolutely emergency travel, is the best thing to do is to stay in place. International airlines have stopped flying for a reason, to stop the spread of COVID. The particular persons you're referring to, of course, no government is responsible for the cost of change of tickets, etc. We understand the inconveniences being caused to persons. That is what our embassies and our consulates around the world are for. We have quite a number in the United States. Reach out to them. The Ministry of Foreign Affairs will become aware. That is one of the things our embassies and our consulates are there for. You have Washington, you have Miami, you have New York in the United States. Reach out to them. We are not going to be just opening the borders. The borders are closed until the 30th of April. We deal with requests for exemptions, but at the end of the day, the safest thing for persons to do is stay exactly where they are. One of the worst places to be on is an international aircraft at this stage. I was exposed to something, and I guess I could share it very carefully with the population. I saw an email, an international email. I was included in this email in error, where a person had tested positive for COVID-19. And the airline's conversation was all about putting that positive tested person for COVID on one of their last flights and allowing the person to travel. And it happened. You have no idea when you sit on an airplane who next to you, who in the plane, especially at this time, may be carrying the virus. So that is not a good idea. I think I've answered all of your questions.
Thank you very much. Priya Bihari.
Hi, good morning, Priya Bihari.
Morning, Priya.
Good morning.
Good morning.
Minister Young, while you were speaking about the embassies abroad, I've gotten a lot of complaints that the embassy, for example, in the UK, the High Commission in the UK, is one that people cannot seem to get any information from. They have sent emails even before the lockdown, and they haven't received an email or they have made calls, and it appears that it has been closed long time ago. That's one question. When you were speaking about the cancellation of the private security firms, you said that if people feel they are a bit safe now, that, basically cancel it. I sense a bit of sarcasm there. Can you just clarify that? Because you gave the impression that we as citizens feel we are safer, and then, so you should cancel those private security firms. One, and the other question is, are you saying that all the members of the defense force are occupied in carrying some beds from Cuba to Cora and right other stuff, and trying to help to make secure a place to carry COVID-19 patients who are recovering? They are protecting Napa, they are doing joint patrols, and they are guarding the military institutions. Can you give me an idea how many members of the defense force there is, and is it that all of them are occupied doing these things? And in the sense that, why couldn't there be additional joint patrols at no additional cost to the taxpayer?
Okay, thank you very much. First of all, let me clarify, there is absolutely no sarcasm delivered in my messaging here this morning. The government has been listening to what the population have said in the last 12 to 24 hours and have taken the decision to cancel the private security firm. So there is no distraction left. We are dealing with something very serious, a deadly virus. We are trying to beat this virus and beat the spread of it. There's no need for any distraction at this time. With respect to that last point that was being made, I want to draw an example. To me, people always understand best when it directly relates to them. Every day, the Ministry of Health and the Ministry of Communication have a press conference, and it's now a virtual press conference. And I always look at the media personnel who are present. Each media house has a handful of media personnel, and you are given different assignments. So you're not going to see from a specific media house all of the media personnel here covering this. It is the same thing with the Trinidad and Tobago Defense Force or Police Service. You have a shift system. Those Defense Force and Police Service, they work on shifts. So not every single officer is going to be out at the same time. Otherwise, you're going to have burnout. There's a rotation. So that is what is taking place. At no point in time did I say that all of them are carrying beds to Cuba and to Cora and protecting Napa. Those are the additional duties. There's been no step down of duties and response by the Trinidad and Tobago Defense Force. So everything that is the reality of protecting Trinidad and Tobago prior to COVID continues. They continue with all of those operations. You now have additional operations. So it is the same all around in every single essential service. It's no different to the doctors and the nurses, where you have a certain number, and what you have to do is logistically decide who will do what, but make sure that you have persons resting. So as soon as that shift ends, you have the other set come on board. And suppose now this thing heads further south, which God forbid, and we are all hoping doesn't, you then need to call upon further reserves. So one of the things we've done in contingency planning at National Security, I've asked the police service and our defense force to look at recently retired officers, not ones who, look at the ones who can come back out to duty. And we have a contingency plan for that if we reach there. So we're continuously planning. Your first question was with respect to embassy closure. That does not fall under my purview and portfolio, but we also need our embassy staff, wherever they are in the world, to be safe and to adhere to the specific regulations and laws that may be in place in those countries. There's a Ministry of Foreign Affairs, which is the headquarters. You can reach out to the Ministry of Foreign Affairs. But if persons, and we have Trinidadians scattered all over the globe, the first place that experienced this was China. I remember the Minister of Health, the Minister of Foreign and CARICOM Affairs, and myself, in January of this year, when it broke out in China and China began their shutdown, we had 120 nationals of Trinidad and Tobago spread throughout the length and breadth of China. We didn't bring them home because it was safer for them to stay there in place. What we did is have our embassy reach out, make contact. That eventually was done. These things may take time. I can tell you, our embassy in Caracas, for example, has been in contact with persons, and our officers at our embassy in Caracas are to be thanked because a few of them have taken money out of their own pockets to provide to nationals. They've arranged certain arrangements for persons or nationals who are in Caracas and Margarita. They told me about it yesterday. For example, their hotel bill reduced to 10 US a day, and they don't have to pay until the end of all of this and Venezuela reopens their borders. We are in very strange, difficult, and unusual times across the globe. We will do what we can, but the main thing is for people to stay safe.
Thank you very much. I think there's a question to social development from Lesana. There was something to be clarified. Lesana? We're not hearing you. Okay, start over, Lesana.
I'm in now. Yes. My question to the minister is really what you could do more to avoid crowds trying to access services. You know, for instance, if MPs could arrange to deliver the cars directly to persons, you know, if the government is trying to keep people at home, what could social development do to have people access services without leaving their houses wherever possible? I'd also like to ask the other ministers a question if possible after.
Okay. Thank you very much for the question. In an effort to ensure that people don't have to necessarily come to the social welfare offices, we put the forms online, and that was one of the mechanisms we were trying to use to ensure that we did not have crowds coming to the office. We still, though, have a number of people who are coming to the social welfare offices, and we have been asking them to please stay at home and contact us via our call centers. We have the call center that is manned by 10 persons, and we also have the emergency lines that is manned by 15 persons. And all the calls are being taken, so we have been asking people to stay at home. With regard to the MPs' offices, what a number of MPs have been doing is actually calling the persons and scheduling them with appointments, because the persons who are getting these food cards are on a list that we have from the Ministry of Education, so they are registered school feeding recipients. The parents' names are on a list, and MPs have been calling the parents, opening the office for a certain length of time and calling parents and telling them that their time is a certain time and they come at that time to collect the cards.
Thank you very much, ladies and gentlemen. You know, we have come to the end of this media conference, but
sorry, I'm sorry to cut my colleague, the Minister of Communications, but I just wanted to say that with regard to flights, all airlines have waived the penalties for change of date. So if that person in the US thinks that they will have to pay a penalty, they do not, because all airlines in every country have changed their policy and have waived the penalty for change of date. So I just wanted to make sure we said that. Thank you very much.
Thank you very much. That is indeed important. And we've come to the end of today's virtual media conference. But before I go, I think the Minister of Health would like to say a few words.
Thank you very much, Minister Cox. I just want to touch on one issue before I give a closing brief. I've been getting literally 100 calls on WhatsApp about masks. Let me reiterate. The NGO feel and only feel will be dealing with the issue of distribution of masks. Do not call feel at this time. They will let the public know when, where, and how masks will be distributed. I want to thank the national community and the media for being a part of this very important press conference for the past 2 hours. As I close, at 10 o'clock this morning, I gave the update, 1,450,000. During the press conference at 10:45, it went up by 3,000 to 1,453,000. At 11:30, it was 1,455,000. In an hour and a half, the global number of positive cases went up by 5,000 in 90 minutes. Ladies and gentlemen, we are in a very auspicious time in Trinidad and Tobago where the three major religions are celebrating significant events in their religious calendars: the Hindus, the Christians, and the Muslim community. I am sure the scriptures of all three religions, we can turn to them in this time for some solace and some guidance. The guidance I would like to take away from this is that from my Prime Minister, the Honorable Dr. Keith Rowley, where we are just trying to get people to stay home. If we stay home, we will achieve the objective of staying lives, and we will not break the healthcare system. I am sure that at this time, when the winds and the tempests buffet us, buffet the ship of state led by the Prime Minister, it is going to be scary. These are uncharted waters. But I will guarantee you one thing: under the guidance of the Prime Minister, the public health officials, and the cooperation of the general public, we will reach a destination where there is calm. But to get there, things may get worse before they get better. The pyramid that I have been showing over and over, I don't know if it's possible to put it up now. If we all pay attention to that pyramid, don't be the star boy or the star girl at the top of that pyramid. If we pay attention to that pyramid and don't start your own chain of infections, the waters will be calmer. The waters will be calmer. The breezes will be less intense. I urge us all to rally behind the Prime Minister, the public health officials which have guided us brilliantly throughout this since January, and we will come out of this in a much better space. Thank you very much.
Thank you very much, Minister Deyalsingh, and that's how we end today's virtual media conference today. Remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. And as we say goodbye for today, we wanted to let you know that we recognize that there are many of you out there with questions, and we want to give you, the public, an opportunity to ask those questions to our panel. As such, we will be hosting a virtual meeting on Saturday to hear from you, and we will provide more information as soon as this is finalized. Keep checking our social media pages, radio, and daily newspapers for an update on this virtual meeting. I am Donna Cox, Minister of Communications. Thank you for joining us as the government continues its efforts to flatten the curve and beat COVID-19. Stay home, stay blessed. May God bless our nation.